Hello everyone, this is Dr. A, and so this is the last chapter of Nile's U.S. healthcare system basics, and we're just going to do a quick analysis of the healthcare system. Is really just an overview of everything we've covered over the semester. Mostly this lesson is going to look at healthcare trends and a summary of everything we've discovered. We'll talk a little bit about IT also. Okay, so did you know the average American physician earns more than 5 times the average U.S. wage, while the average French physician makes only about 2 times the average French wage? And one of the things, of course, that's not said in there that you may or may not know is that, in France, the medical school is pretty much paid for, and whereas in the U.S. It's not, and physicians do come out with really high student loan debt when they come out of school too. But U.S. physicians do make a lot of money. According to the U.S. Census Bureau of 2017, the national health insurance uninsured rate is nearly 29 million people, or 8.8% of the population. We can definitely do better than that. Although the United States is the most expensive healthcare system globally, when you compare it to 10 developed countries, the United States ranks last in overall healthcare performance, which is evaluated by efficiency, equity, and individuals' health. They look at measures such as, lifespan, life expectancy, and infant mortality, and there's all kinds of other measures that can be used like that to compare one system to the other. So, the U.S. healthcare system has long been recognized for providing state-of-the-art healthcare, meaning really if you want the latest and greatest, you can usually find it in the U.S. Now, granted, it may or may not be covered by your health insurance, but if you have the money, you certainly can get it done. So if you wanted to go do, for example, stem cell injections for looking younger, for rejuvenating your joints, for healing a traumatic brain injury, if you have the money to do it, you can do it. It is also the most expensive healthcare system in the world, and the price tag is expected to increase. We have a lot of the technology, we have the cool stuff, the cool toys, but it definitely has a cost. The U.S. healthcare system is a complicated system because it has both public and private resources, whereas a lot of the other systems in countries that have universal healthcare or universal coverage, their system is a little cleaner, a little easier to navigate. It's just one big system, whereas ours is just a patchwork of public and private entities, both in the payment and in the delivery. So although U.S. healthcare costs are very high, the United States does not offer healthcare coverage as a right of citizenship. We're really the only developed country that doesn't do so. And again, just stated again, even though we spend the most, we have the worst performance compared to others that, spend less than we do and have universal coverage. And again, we're the only major country that does not offer healthcare as a right of citizenship. So a little bit on the Affordable Care Act. So the Patient Protection and Affordable Care Act was passed in 2010. It's also known as Affordable Care Act or Obamacare. And its amendments focus basically on on increasing access to primary care as a foundation to the U.S. healthcare system. It focused on 6 areas to improve the U.S. healthcare system: quality of healthcare, affordable and efficient healthcare, meaning healthcare that people can actually purchase and buy services at a reasonable price; and efficient, meaning doing what is needed, not a lot of extra stuff, not a lot of extra costs on unnecessary tests and procedures. Then they focus also on public health and primary prevention of disease, because that's really where the money saving is. Then also healthcare workforce increases. The healthcare workforce is increasing. We need to continue training people to enter the workforce in the healthcare industry. Focuses also on community health as a much better alternative to people being institutionalized. And of course, increasing the revenue provision to pay for the reform also. The Affordable Care Act has attempted to increase access to affordable health care, and part of that was to implement those electronic health insurance marketplace. And these provided opportunities for consumers to search for affordable health insurance plans. So now you can shop health insurance plans just like you can shop car insurance plans. And so that's been a major big change. Like before, if you consider before the Affordable Care Act, the only way you could get really reasonable and affordable healthcare insurance was to work for a big company, because big companies could negotiate cheaper prices for their health insurance. And so it would make it more affordable for their employees. If you were self-employed, you just didn't have that option. It was really hard to find affordable coverage, or you would have to have a spouse that, worked for a big company that could include you on their health insurance. The Affordable Care Act did come out with a mandate that individuals who do not have health insurance have to purchase it or pay a fine. That was, of course, later deemed unconstitutional. And so we're not sure exactly what the impact of these events have. So one thing you have to understand, this is probably behind what the initial motivation for that mandate was, of the fine if you did not purchase health care, was because they wanted to try to increase access, increase coverage. But of course, people have to participate. So it was a way to force participation, was to implement a fee. How other countries do this that have universal health coverage is they either do it through taxation or like mandatory contributions out of your paycheck. So if it's for taxation, they're going to take the taxes and you don't really have a choice to pay or not pay them, right? And if you don't pay them, they come after you. Just like the IRS will if you don't pay your income taxes and or sales taxes or things like that. And the mandatory contributions are similar to what we already have coming out of our checks, where they deduct money for Social Security, for Medicare, federal income taxes, state income taxes, etc. You have all these deductions that are mandated. You really don't get to pick. Or you can tell them not to take any income taxes out, but then when you file your taxes, you have to pay them. And so they, in countries that finance the healthcare through mandatory contributions, there is so much that's being taken out of everybody's paycheck for healthcare. So what do you think about the individual mandate not being fined? So being fined for not having insurance, do you think, is this a good idea, yes or no? And so in our class, it's usually divided about half and half. So the government role in public health. So the government does play an important role in the quality of the U.S. healthcare system because they provide funding for state and local government programs, especially through their Medicare and Medicaid programs, but also through the CHIP programs, so the children insurance programs, but also through the VA, the Indian health system, through the military health care. And so and also, of course, the government also sets policy for a lot of aspects of the U.S. healthcare system, and policy is how change is made at a large scale. So the role of public health is important to healthcare because it protects the public with social regulations. We've seen this in the last year with the coronavirus pandemic. For example, some of the social regulations that were put in place to protect the population. Well, first we had the mandatory quarantines, and then we had the social distancing, wearing a mask. All of those are types of social regulations that can be put in place to protect the public. And of course, but along with that, public health also is involved with education to how to change a health condition or behavior. So we even saw that with the pandemic. Videos that were put out by the CDC and other entities explaining why masks protect, why wear them, why social distancing, educating about everything, educating about the pandemic, the coronavirus, what it is, what do we know. And so the same thing, if you see a campaign against vaping, that would be another public health type of campaign to help prevent the damage to the lungs of young smokers or vapors, vapors, and try to improve public health. So again, it just targets large segments of the population or the population as a whole to modify a behavior or to educate about a condition. A little bit on inpatient and outpatient services. Basically, there's been a move towards more and more outpatient services because they are more cost-effective, efficient, and consumer-friendly. People would rather, if you give them a choice, to spend a night in their own bed, to eat their own food, and it is, cheaper. So outpatient procedures are more often done in outpatient therapies, etc. And so the hospitals have partnered with outpatient facilities or developed their own outpatient services because they were getting less revenue from inpatient, and the revenue also, the reimbursement rates were being cut from Medicare and Medicaid, or being cut down, not cut completely out, but, diminished, if you will. And so this, the incentive, of course, of increasing that accessibility of the outpatient services was also to improve the financial stability of bigger entities, big hospitals, hospital networks and stuff, just because that's where people are moving to. They prefer outpatient. So a little bit on healthcare personnel. So the healthcare industry is the fastest growing industry in the U.S. We employ about 18 million healthcare workers, and it's more than 13% of the U.S. workforce, and it's also a growing industry, and it will generate nearly 2.5 million new jobs. That's on top of the 18 million healthcare workers already by 2026. And so this is more than simply people retiring and people filling positions. These are brand new positions being created due to increased needs, increased work needing to be done, and most of that is driven by the aging of the population. All right, so on that, I've got a link here, and I can link some of these, but what are jobs, for example, that you may have not considered before that you've learned about in our unit? If not, look at, do a Google search for like high-paying jobs in healthcare, jobs that are in high demand in healthcare, and just kind of take a look. And so that just to expand, especially beyond your traditional, I want to be a nurse, I want to be a doctor, even though we need primary care physicians, but the demand is such that you can go and become a physician assistant or a nurse practitioner. So those are two different pathways with a master's degree, and become a primary care provider, especially in rural areas, because there is a need for primary care providers. Sorry. Next, it was IT. So IT has really revolutionized the healthcare industry. Some of the biggest ones have been the electronic health records and electronic medical records, making everything more standardized, easy to access, more searchable, and also giving patient access to their own healthcare data. And so this has been the electronic chart is being a really huge improvement, especially then linking the electronic charts to across the healthcare workforce. So from hospitals to pharmacies to outpatient facilities, etc. Also, telemedicine has become more advanced and cost efficient. We've especially seen that during the pandemic because that allowed people to still get consultations without having to actually go to the clinic. And then we covered healthcare law and ethics. So definitely important to understand the basic legal principles that influence the healthcare work environment. This is simply for you, any of you guys that are out there in healthcare practicing, you really want to know, what are the rules, how to not get in hot water, especially things with HIPAA, because if on some of those, if you commit a HIPAA violation, that's a federal offense, and that can be a felony if you're found guilty, and that can actually keep you from being employed in healthcare altogether. So it's really important to know the legal principles, but it's also good to know simply your rights as an employee, rights of the employer, etc. And then, of course, the other one, and this is where people that work in healthcare need to be careful also, the legal relationship between a healthcare provider and a patient. And I would say if you're on the provider end or working, just be careful of what you say and advise patients. Make sure that's in the scope of your practice. That that you don't, unwittingly give medical advice that people could follow and then sue you later because things didn't go, the way they expected. So just, protect yourself and be careful. And then ethical standards are considered one level above legal action because it's the right thing to do, not simply what's legal versus what is not legal. The whole ethics is basically to think about as a big old gray area, and that the one thing that really wanted everyone to take away from the ethics lesson is that not everybody thinks like you do, because everybody's got their own experiences and values, etc. And so, like, within any one scenario, we had asked a question with euthanasia, and whether or not one thought it was ethical or not, and whether or not one could carry it out. So different combinations. And every time I ask this question about where they stand, ethical, not ethical, or could you do it, could you not do it, and in combinations, that gives you four different options. There is, in every group, all four answers. So that it really shows that even in smaller classrooms, there's disagreement on what is the right thing, what is considered ethical, what people's stances are. And there's just so many interpretations of the concepts of ethics, but it is a moral foundation for the standards of conduct, in which definitely are vital in healthcare. For sure, you probably need to be aware of the standards of the place that you work for. What do they value? What are some of the standards that are like non-negotiables? And then within your scope of practice of whichever field you choose, they are like ethical standards of conduct within that practice. You need to make sure that you abide by those for sure. And so this is just about what was the law or ethics thing that we talked about that you liked. And then the last big chapter was mental health. And it's important because mental health disabilities reduce the life expectancy of individuals by several years. And treatment has been underfunded because of the attitude of the traditional healthcare system. And I will add to this that some of that stems out of the research industry. So scientific research has been obsessed really with what is easily measurable and quantifiable and things. So that a lot of the physiology and how the body works, and all of this is important, and it is also important to mental health. But being able to diagnose a disease and then to treat it and to try different drugs for different conditions, and where you have actual measurable outcomes, you have something tangible that you're looking at. You're looking at receptors or levels of something or this and that. And that's really been the backbone of the research industry, where mental health, it's all more kind of gray areas. Nebulous is harder to measure. Everybody's different. It's not like you can do a blood test and it just tells you automatically, oh, this is what's wrong with the mental health of this person. It just doesn't work that way. And because of that, in a way, and I'm not saying this is right, but it's been like kind of seen as a less valid side of science, and therefore less funded. And so that is, part of why mental health has been underfunded. Now, we've tried to rectify that with the Mental Health Parity and Addiction Equity Act in 2008 and in 2013 to support mental health by requiring insurance plans to offer benefits and cost-sharing provisions for mental health treatments that are similar to those for traditional medical care. And this is something that I personally have seen in, ever since I started my own career, that has greatly improved, where it used to be not covered, and then it used to be like, yes, it's covered, but you first have to meet your deductible, usually meaning you still had to be out like $500-600 before you can even start getting any kind of coverage, to now it's covered at the same rate as a physician's office visit is. So a therapy visit is about the same rate as a physician's office visit, which is much, much better. So I'm going to list this mental health barriers video in the links below in the bottom. If you're in my class, you'll have it in Nearpod. And so then I want you to think when you're watching this video and then you do the activity, a stigma that can hinder a person of color from seeking mental help, a way to express that one is depressed that depends on one's culture, and a couple of barriers that can keep them from getting mental health treatment. And then last, we're going to look at some of the trends in healthcare. So integrative medicine or functional medicine is a combination of complementary and alternative medicine. With the traditional medicine approach, the U.S. consumers spend a lot of money on alternative medicine each year because traditional medicine, in a lot of cases, especially chronic diseases, just not working. And of course, people that are uninsured and underinsured will use CAM more readily, also alternative medicine. But there's a lot to be done and said for integrative medicine. They're more of a root cause kind of medicine. Just to give you an example, integrative medicine, functional medicine, for example, in an autoimmune issue, instead of doing a traditional model of simply giving a person immune suppressants, what integrative medicine or functional medicine will do is find what's at the root cause. Are there nutritional deficiencies that are causing the immune system to overreact? Is there exposure to some heavy metals, mercury, etc.? Is there mold toxicity? Like, there's so many things that we'll look at to find out the root cause of why this person's immune system has decided to attack whatever it's decided to attack, depending on the autoimmune disease. And then manage the condition by changing getting to the root cause and modifying that so that the patient can heal from the inside. The Greenhouse Project is a wonderful project. Basically, it's a unique type of nursing home that looks and feels like a home. There are hundreds that are open and under development in many states. This is a really great thing. So I am going to list a functional medicine video also. And, a couple questions there on functional medicine. I'm going to link some of those. And then I'm going to link the video on the Greenhouse Project too. And you guys that are in my class, you can just do the Nearpod activities as required. So then other trends are accountable care organizations. So they're groups of providers and hospitals that seek to provide coordinated care to Medicare patients. And so the goal, again, is to ensure that patients get timely care and no duplication of services, then therefore that prevents medical errors. And so these are usually in the area, that where the person lives, and their networks are usually cheaper for the Medicare recipient to buy into those types of plans too. Pay for performance or value-based purchasing or healthcare payment systems that reward healthcare providers, including hospital physicians and other providers, for efficiency, which means high quality care for less. And so there's different payment models, there's standards and things that they look at, but basically being rewarded for doing a good job by usually getting higher reimbursement rates. The patient-centered medical home is another trend. It's a coordinated care delivery model through the primary care physician to ensure that patients receive the necessary services. So basically, the primary care physician acts as the coordinator of all care, and all care has to go through him and back to him or her, so that you have a centralized setting, well coordinated, no duplication of services, not one person doing this, the other person doing that, and the things are working against each other for that poor patient. So it does facilitate cooperation between the patient and the primary care provider, but also between a patient provider and the specialists and stuff. So this has been greatly facilitated by health information technology. So those health information exchanges where information can be sent back and forth from primary care to specialists to pharmacies and all the other facilities. So of course electronic health records have made this possible. And so this allows patients to get the care they need when they need it in also a culturally respectful way. So another trend is the Center for Medicare and Medicaid Innovations. And so they're looking at developing and testing innovating healthcare payments and service delivery models. So they, basically what they're saying is like, hey, if you found something that works really well for a certain, disease process, a certain procedures or whatever, and you're getting really good, it's good outcomes, it's cheaper and all of that, then you can share it. And then if they adopt it, then that could become the standard for the nation. Mobile health, so this is referring to mobile phones, so smartphone apps that patients use for accessing healthcare information and tracking healthcare activities. So you can track things like your steps, your heart rate, what you eat, how you sleep. If you're a female, you can track your periods and stuff. And you also have access to a bunch of health information. And so there are over 100,000 types of apps related to health on the market. And then, of course, telehealth refers to the use of information technology to enable healthcare providers to communicate with the rural healthcare providers regarding patient care, or to communicate directly with patients regarding treatment. So this is where you can get messages from your physicians, reminders about appointments, test results, etc. through that app, or through whatever email delivery or whatever services you've got established with them. But it's really great for consultation again. So a lot of rural clinics can have access to bigger entities like the Cleveland Clinic, the Mayo Clinic, Johns Hopkins, or whatever, and you can get consultations from specialists without the patient having to travel. All right, so this is again a quick question. What are a couple apps that you use on a regular basis? The RFID chips can transmit data to receivers, so this is usually used to track things. So you can track wait times in ERs. You can track the use of what is being used in surgery. You can track costly medical equipment. You can identify providers in hospital to identify efficiency of care. So this is also meaning here, if you work in a hospital, whether you're a physician, a nurse, lab tech, x-ray tech, or whatever, your ID badge can have an RFID chip in it, and so they know, they can track how much time you've spent in the break room, how much time at the nurse's station, how much time are you spending in a patient's room, in the bathroom, etc. And so to make sure that people aren't just sitting at the nurse's station, not moving, not checking on the patients, etc. Drugstore clinics are another trend in healthcare. They're not trying to replace primary care providers, but simply increase access to healthcare, where you could go in, have a quick consult for minor stuff, and then they can recommend, whatever treatments. And walk-in clinics are, of course, now a common feature. So these are, you don't have to be an established patient. You can come in and, again, just be seen. And so that's a new thing, so retail clinics. Next is health navigators and care managers. So this is a new type of job, and they can combine nursing, social services, disability assistance for people who are usually eligible for Medicare and Medicaid, and they suffer from a chronic condition, and they cannot handle managing all of this chronic stuff on their own. So the goal of a care coordinator is to avoid the patient's placement into a nursing home. And so, quick question. So look up that job. What does it take to be a patient care navigator or a patient coordinator? And then, of course, lastly, we need cultural competency in the U.S. So we really need representation from all the cultures within the healthcare industry. So that then can allow also for more cultural respect, cultural health competency, and so that will improve our healthcare system. And so it's nice to have a variety so that we can make sure we meet cultural needs, linguistic needs, identify assumptions and stuff. So it's really, really important for us to diversify in healthcare. All right, and that's the last slide. So if you have any questions on this lesson, please let me know. If not, thank you again for your attention.